If you've ever had a friend or family member struggling with drugs or alcohol, it's oftentimes difficult to know how to help. Today, I have some of my friends and local experts here with me to discuss this. What are some of the resources that exist in our community to help people that are struggling with drugs and alcohol?
Thankfully, there's a lot of different resources. It depends on what level of treatment the person needs, but we have places like Avita that is open to the community and provide a variety of levels of care, and Laurelwood, which also provides detox and some great level of care as far as inpatient care, and they started an outpatient. Places like Twin Lakes. So it's a matter of doing an assessment and figuring out what level of care does the person need, detox, outpatient, or other ongoing levels of care. And then we have support groups as well.
And where might an assessment like that take place?
Sometimes it can start off in the family medicine practice with the primary care if they have a specialist there, or in some cases where it's more dire or the person's in a life-threatening situation, the emergency room can be the central hub of being assessed and allocated out to resources in the area.
This sounds like there's a lot of resources. Why don't our loved ones know about them or reach out to them?
Well, a lot of times it's really difficult because there's no reason for them to know in most cases. If they've got friends or somebody like that in recovery or that's gotten help before, it makes it a little bit easier. The other side of it is sometimes people are embarrassed to ask for help, and it makes it really tough. And so there's a lot of places out there. It's just being willing to call and ask the question. Kind of like what Devin was saying, you can call your family medicine doctor, and a lot of times they can put you in contact with somebody. You can call Jay's Place Recovery Center, and they've got all kinds of resources that are free to the community, and they can refer you out to many different organizations in our community. The Compass Center at United Way has a lot of resources for our community to tell people where they can go, because we have care of all the way from people who are indigent, don't have anything. This is a great community, all the way to people who, like Devin was saying, that need to be in the hospital.
What resources, Danielle, are available for folks like us that are trying to help our loved ones?
Well, I think it's important to not chase the chaos of the loved one's addiction or substance use, and how a lot of people have learned to do that is finding parent support groups, finding family support groups. Al-Anon is a really, really great resource that people can use to learn how to have firm boundaries and how to detach with love. And it also teaches them how to have a confidence in themselves to deal with this whole situation.
Basically what happens is it is enabling, and unless a person has a reason to leave or to change by enabling in that manner, you're not giving them any reason to do anything to change. There's no reason for that.
People have to handle the natural consequences of their choices, or we're robbing them of the journey of finding their true purpose, And if they don't find it on their own, if we create the situation where everything is cookie cutter to their needs for them, they're not going to get it. It's going to find them right back out a year later or less, and maybe they won't come back that next time.
Addiction really is a family disease, so does it discriminate?
It does not discriminate. The American Medical Association recognized addiction as a disease because it's progressive, chronic, and fatal. I mean, the great thing is it's treatable, but it shares the same thing as any other disease: progressive, chronic, and potentially fatal. And so that does not discriminate.
And it doesn't matter if you have millions of dollars or you have nothing. It can affect everybody the same way.
Another resource out there is 988. It's equivalent to, let's say, like a 911, but it's for mental health and substance use disorder. And this is a number that you can call 24 hours a day. A clinician will go out, a parapro, which is what I do, will go out, certified peer specialist, and they'll go out and talk to the actual person. They'll go to the home. It's a mobile crisis unit. It's 24 hours a day. They go in with the clinician, and the para goes in, and they assess the situation. They do an actual assessment, and then many things can happen from there. It depends on the situation, but you'll have a safety plan, and you can go to wherever you need to go, whatever's recommended and whatever the situation is. So.
Well, thank you so much for all that useful information. I am sure that it's going to help our community. If you or a loved one struggle with addiction or mental health issues, reach out and check in, because together we are united around mental health.